everybody. Welcome to Meg's Provider Spotlight, where every week we are coming here to interview the most amazing private practices from all over the United States. Every week is so awesome. We get a whole different, brand new perspective from all different specialists all across the land. And today we have a very special guest for you. We're super excited to introduce Dr. Emma Westermann, owner of Healthspan Immunology. So, welcome, Dr. Emma. We're so excited to have you.
Thank you so much. I'm excited to be here.
Same here. I know we have a lot to get through, and a lot that we really want to know about. But I think at first, I always kind of like to start off with getting to know you. And I think, as well as everyone else, is kind of dying to know your background, your story. And so we would love to know, like, what inspired you to be here? What inspired you to open up your own practice and start things?
So, Healthspan Immunology, I opened almost exactly a year ago in November 2024.
Nice.
It's now January 2026. Um, and what inspired me was kind of my journey through the medical system, where even back in medical school, I was really interested in the complex patients and really wanted to understand everything about them. And I would get feedback that, like, the patient is here for lupus. We are not going to talk about the other things going on with her. And I always struggled with that. And in residency, I had to kind of hone my focus, of course. I even ended up working in an emergency room, doing nights for a while, where you really had to be focused on the
Yeah.
presenting problem. But I always have in the back of my mind that a person is a whole person,
Yeah.
mental health, diet, environment, everything. And um, then in fellowship, I specialized in allergy and immunology. I was drawn to it because of that
Yeah.
aspect, the environmental aspect on health, the pollens in the air, the um, all the things that we encounter in our
Yeah.
environment that our immune system has to deal with. Um, and so I did fellowship in allergy immunology, then worked as an immunologist with the university for a while. And then the pandemic hit. And I think we're going to get into that and what happened with my son during the pandemic. But
Mhm.
after the pandemic, I came back into medicine. I took a break, came back into medicine doing locums, which
Mhm.
is where you're just like covering shifts wherever you're needed. And I was working in the practice where I actually trained, which is
Mhm.
great. It's an amazing practice, wonderful staff, just a great environment. And it was kind of like a trial period to see if they were going to hire me as another doctor in the practice.
Sure.
It would have been a great honor because it's my mentors. Um, and at the end of the year of doing once or twice a week locums, my mentor and I met. And he said, I have the utmost respect for this man. He said, we love you. The staff loves you. The patients love you. I had gotten multiple like 5-star reviews that the practice manager would always email to me. And he said, but you're just not quite efficient enough.
Mhm.
And I totally get that. Like the way that medicine is practiced today, you
Yeah.
have to see 20 to 30 patients a day to keep the lights on because insurance reimbursements are going down, down, down. And
Yeah.
patients don't realize that. It's not the doctor. The doctor wants to spend all day with you. It's the insurance company that's only giving him, a small amount for that time, and he has to pay his nurses and so forth. Um, so I agreed, and I said, "Look, I'm not interested in practicing medicine if I have to adhere to that model. But I think I know that there is a population of patients out there that need what I have to offer, which is an in-depth approach to complex disorders.
Yeah.
And so I opened Healthspan Immunology.
I love that. And it's such a interesting perspective because, you know, I think a lot of us are now conditioned to feel like, okay, well, the doctor's running late, and then they don't really have enough time for me. So I got half my questions in, and they couldn't give me a lot of information either because they're pressed for time. And so I don't feel like I got that comprehensive, like, look at what's happening to me. And then I think a lot of people feel like a little disheartened by it, about what's happening with their care. And I love the way you put it is that, just throughout your career, like I have these thoughts about what is happening to you and things that could help you and things that can move the ball forward, or maybe this is why this is happening and this is the snowball effect. And I understand that you're here for lupus, but like there is so much to autoimmune diseases that we're not just treating the lupus. There's so many factors that are going into how you're feeling. And so why are we talking about just one thing? And so I can just
Exactly.
really appreciate that approach. And I think people really enjoy hearing why it's difficult, like if you're not feeling great, but it feels like you're getting somewhere. When someone's like, hey, I have like a list of things, I'm kind of excited. I'm like, really? Great, because these are all possible answers to making me feel better. And so I love your approach. And yes, there is definitely a population where this exists. But
Definitely.
off of that tangent, I would love to hear about, currently what you're doing today. What are maybe some of the most common areas that you're treating and, that people are struggling with? But maybe also talking about things that are uncommon. Like what do what do people not realize that you help treat?
Yeah. And just to your point,
Hmm.
it's not efficient for the patient to bounce from doctor to doctor to doctor and not get answers. It may be
Yeah.
efficient for the doctor, but
Yeah.
it's really not efficient for the patient or for their family or for society.
Yeah, it's not. And even if it's like you're passing it off to another patient and something that maybe you could have solved and you can send notes to the next person and say like, hey, I really need you to do X, Y, and Z, and then they can take it from there. But when they're just kind of, yeah, when the patient's just hopping around and the buck is just, for lack of better words, maybe being passed to the next person to deal with it, then nothing gets solved for the patient. Or as a doctor, I'm sure it's not as like fulfilling?
Exactly.
Yeah.
Exactly. So currently I see a couple of different buckets of patients. One
Yeah.
is immune deficiency. So patients that have always gotten sick more than their peers, like maybe a few more sinus infections than average, maybe a pneumonia here and there. Kids, adults, we want to catch those patients as early as possible
Hmm.
and intervene. Many of them actually present first with autoimmunity. So that's something to watch for. The kind of the biggest red flag is if you have autoimmune hemolytic anemia or two types of autoimmune blood disease. That's called Evans syndrome when that happens, and that's a huge red flag for underlying immune deficiency.
Hmm.
So those patients I see, and then of course just allergies, contact
Sure.
dermatitis, eczema, that kind of thing. Um, and then complex disorders. So my nickname is Mayo because I love mayonnaise. I will eat it by the spoonful, but also because I'm like, people say I'm like a mini Mayo Clinic.
That's
I,
really
I,
funny.
I, I will really dig in and then get the patient to whatever other specialties they need. And the best people in those specialties who
Nice.
also
Yeah.
have a lot of curiosity. Um, so yeah, complex disorders. I have patients that have been with me for a year and we solve the first problem. And then we go and attack like and what is that, thymic blob that you have on CAT scan from 8 months ago that everyone's told you is nothing? Like,
Yeah.
you're having a lot of flushing and swelling right here. Like maybe the thymic blob is important. Maybe we should address that. Um, So anyhow, there's lots of lots of patients in that category.
Yeah,
Mhm.
absolutely. It seems like, there's there's things that there's I think there's always more that meets the eye, and that's why I love that question is because, there's things that people are, they think about immunologists or people allergists, like there's certain things that they know that that person will help cover, right? But there's things that I think people are not so aware of, and even down to other physicians, there's things like, oh yeah, I didn't think about to send my patient to someone like Dr. Emma because, I blanked on, yeah, that's something that she can definitely help my patient with. And I sent her to a rheumatologist instead. And Dr. Emma could have taken care of the whole thing,
Mhm.
right from the get-go. And so I think that's just like really important to note that like you're doing a lot of things that I would say that blend lines maybe with some what other maybe physicians would be doing as well.
Yeah, because the immune system interacts with every system. So I have a patient recently that was referred for hepatomegaly after a viral infection. And,
Mm,
is it an underlying immune disorder? Is it autoimmune? Is it a genetic problem? Like, I don't know yet, but we'll dig in and find out. And then if it's not in my area, then I can refer her to someone that's their
right.
specialty.
Yeah, so that's what I mean. I mean, this stuff is so fascinating, and I just loved your spirit of like, let's dive in deeper and let's, find the root cause. And I love that. And I think that's a part of what makes your approach, really unique and special. But is there anything else that you'd say, for someone that's listening in, what are some other differentiators? Like, what are some things that you feel like your approach is so different and or what you really appreciate about how you approach each patient?
So I should also mention that the last bucket of patients that I see is
Mhm.
kind of neuroimmune, PANS,
Mm.
PANDAS, which we can dive into further if you want to. But there's a huge need for seeing those patients.
Yeah.
And a lot of them are autistic. And there's just unimaginable suffering in that patient population, in those families. So I feel very grateful that I'm able to spend the time addressing not only the medical issues, but also the mental health. That's a
Yes.
big part of my practice, getting you started on a mental health journey, getting you to the right mental health provider, um, giving you a reading list that can support you. I do a little bit of nutrition. And then once we have kind of optimized those pieces, then that's when we can start looking at the longevity piece, which is why I called my practice Healthspan Immunology. I really wanted to do longevity. But it turns out that in my patient population, most people aren't there yet. They're just trying to get through the day. They don't even know what a good diet looks like. So we're doing like
Mm.
longevity 1.0. And eventually, hopefully, we can get to 2.0 or 3.0.
Yeah.
Um, so, yeah, I would say that's what differentiates me is that like the other direct care practices in Tampa, and there's a burgeoning community for direct care, which means cash pay or concierge.
Yeah.
Um, I have the luxury of spending that extra time with my patients.
Sure. Absolutely. Yeah, that's number one and so awesome. And, what you said in my mind earlier, Dr. Mayo, I think that's really the Mayo nickname is really sticking to me. But no, Dr. Emma, I can really appreciate what you guys are doing, and how you're seeing each patient, how inclusive you are and to other populations as well, because I think it takes someone really unique and with patience, but also deep caring to, work with, autistic, kids, adults, anyone in special needs, because I think there also can be like a lack of, or it's harder to communicate sometimes. It's maybe harder for them to communicate at times, and to kind of read between the lines and share and hear what they're feeling, how that affects them day in, day out. So that's
Definitely.
it's
I'm
really,
learning more from them, I
yeah,
think, than I'm teaching them.
Yeah, and so it's actually really amazing and fascinating that you're doing that, and what a wonderful population and an underserved population too. I think there's a lot that I'm sure, like any patient walking in, things that get dismissed or you're telling someone something and they're not hearing you very well, or you feel like they're not hearing you very well, and so that's really great that you're taking the time to help this very specific population out with how they're feeling and helping them get better. And something that I would love to dive into, because again, I think you shared so much about, what you're doing, but also I feel like everything that you've shared has been something that's uncommon, and I think not everyone does or has the capability to do, but in the vein of that, with all the research that's out there today that you see online, maybe the Mayo Clinic, you always see like their articles online. And not saying that, that's bad or anything like that, but people are utilizing like ChatGPT and they're utilizing, I'm not sure if WebMD is a thing anymore. That was always the thing that like, it would ask you all these questions and then it would prompt you with like, okay, you have cancer. That was always like the joke, right? And you're like, that's not true. So are there things today that like you get people coming in with that are like still old wives' tales about, how you should be going about something, or someone's trying to self-treat and you're like, where in the world did you hear that from? Like that's crazy. Um, Let me tell you what you should really be doing. Or, there's just a lot of information out there. So how do you, as a physician, kind of, what can you debunk for us today? But how do you go about debunking things for your patients that, when there's so much noise in the medical world?
It really is. And you can't blame patients for, I have some patients that they're treating autoimmunity by taking drops containing their own urine and blood. Okay. And to my knowledge, there's not evidence to support that approach.
Yeah.
But I don't blame them. They've been to quote unquote regular doctors who have brushed them off. And so what are they supposed to do?
Yeah.
Um,
Yeah.
so I don't, I try not to, although sometimes I do get frustrated. I try not to to, you know, disparage any one approach.
Yeah.
Everything will work for some people.
Yeah.
And we're all learning, and there's new evidence emerging all the time.
Yeah.
So it's not for me to say, oh, that's wrong. But I'm actually thinking about implementing a survey that looks
Mhm.
into the patient's, um, and there's validated surveys in the psychology world about the patient's willingness to grow, willingness to learn, readiness to change.
Ah,
Because I found that the patients that really do well in my model are the ones that are smart and curious and they want to do their own research. So yes, they're using ChatGPT, they're
mhm.
getting all the information they can, but they're also responsive.
Yeah.
If I say, "Oh, that's interesting, but that's not how I do things, and we're going to take this other
Yeah.
route instead," then they're like, "Okay," and they trust me enough
Yeah.
to try it.
Yeah. Trust the
Um,
process.
right.
Yeah.
Yeah.
I love that. Yeah, I think it's really, I do like the use of technology. It's out there, right? But I'm always a bigger fan of like, you are the doctor that I am enlisting to help me with my care. And so I trust you and I trust the process and in terms of what I'm doing. Now I'm happy to ask, like, hey, I am very interested in my health and I have these questions. How do you feel like it pertains or does not pertain to me? Or if this would not be a good thing? I'm just really curious about it. And I think all those things are great. It's building curiosity. It's building like you're in it with the doctor. Like you want to get better just as much, and you're willing to put in, the 1% better every day to get there, following their guidelines. So I like it for that use. But yeah, some of it, I think use it wisely and trust your doctor too. You got to trust that process.
Yes, but no question is too much. Like um, people ask, someone called me today and asked if it was okay that their child was not fully vaccinated.
Hmm.
And I said, of course, just let me know if you've had a measles exposure in the past 21 days.
Right.
Just, you know, there's some measles outbreaks in certain states. I understand why some parents question vaccines, and I think those questions, need to be heard. Patient experience and mother's experience is often valid. We need to listen to their
Oh,
side
yeah.
as well. So I'm
Yeah.
always curious about each individual experience.
That's awesome to hear. Because, yeah, I mean, with something, specific to that is definitely, controversial. Everyone has a different opinion on it. And I think you just have to find the right provider for you that's going to understand where you're coming from and, work something out with you that makes sense for you and your family. And so I love that you're taking this approach and you love to field questions and to not shun away from the curiosity, but kind of dive into it with the patient, which I think is great. Um, and you've been so, by the way, Dr. Emmer, you've been so awesome in sharing like all of your insights and your tips with us and your misconceptions on what, that are in your field. But I would, maybe to round off today, if you don't mind, I would love to hear maybe some pro tips for, people in the community, things that they can do every day or like homework or things that can move, their health trajectory forward in a more positive direction. And then maybe there's some tips also, pro tips not only for patients, but maybe also pro tips for people that, are in the same position as you that have started their own practice. Maybe they're brand new, or maybe they have had 25 years in their business. And I think everyone should be open to learning something new that they didn't maybe know yesterday. So I'll give you the floor, but I'd love to hear Dr. Emma's pro tips for today.
Well, I'd love to say we're at the point where I could give everyone some tips to enhance their longevity, but I feel like right now, globally, we're at the point where we're just trying to get through every day. There's so much chaos out there, and I would just hope that the families that are really struggling, a lot of the families that I see, just just don't give up. That's all I can ask at this point. Um,
Yeah.
Give our office a call and we can try to help or point you in the right direction. There's so much suffering out there. Just be kind to yourself, be kind to others. And that's really all I can say right now.
Yeah, I love that. And I think it's a really wise way to answer that question. And I'll tell you why, because, yes, sometimes it doesn't feel like you can do one more thing in a given day. You're like, I just can't take it anymore today. I can't do one more thing. And maybe that one more thing is like, I cannot do one more thing, but I will not give up. And I kind of love that is just keep trying. Um, don't give up on how you're feeling. Um, you know, do something that makes, maybe you feel 1% better every day. Um, and so yeah, maybe it's just to not give up, to keep your mind open, to explore, to try a new physician, to try, you're listening to this, maybe call Dr. Emma. It's all those things. Because there is so much chaos in the world, and sometimes there's only one thing you can do is put the one foot in front of the other some days. And so um, I love this question because everyone answers it so differently. And that was definitely a different response. And I think a really cool response because I think oftentimes we can be quite prescriptive about, you know, what we should do.
Exactly.
Yeah.
Yeah, and I think you need to develop that relationship first before you can give advice that the patient is going to be accepting of.
Yeah.
And then for people who are starting their practices, I I would say, um, you know, the current model of healthcare is not working for anybody other than the insurance executives. Big pharma gets a bad rap, but honestly, it's definitely more the insurance companies. Um, and patients do need your knowledge. They need your compassion. And so try to find a way to create a system around you where you can develop that relationship with your patients, whether it's concierge or direct care. Um, it's really, really hard to do in the insurance model these days, unfortunately. I wish that I had found or that I had known that there are consultants that will help you set up your practice
Mhm.
so that you won't have all of the kind of pitfalls that I encountered
Mhm.
in terms of, getting my electronic medical record to connect with Quest Labs and, learning how to bill people properly and efficiently and all those things, running a business that we just don't learn in medicine. There are consultants that will do that for you. And I wish I had dropped the 25 grand that it would have cost to do that in the beginning.
Yep.
It would have saved
Yep.
me a lot of time and heartache. And it also helps your practice appear more professional and like you kind of put it all together. But we're still ironing those things out 1 year in. Um, and I'm really grateful to my patients who have stuck with me the whole time.
That's awesome. Yeah, I mean, I think, you know, kudos to anyone starting anything. It's so hard these days. You're on your own little island wearing a bunch of different hats that maybe you intended or didn't intend to wear. And, you went to school to help people, and to help them feel better. And you didn't go to school to like try to start a business and how that should all work. And not even just a normal business, a healthcare business with 10 times more red tape, than any other industry, right? And so, I just commend everyone that's in this field, including you, Dr. Emma, who has stepped out on their own because it's not easy. And this is exactly why we're doing what we're doing with Provider Spotlight, is because we want to highlight great people like yourself that are moving the needle forward, wanting to help others and doing it in an extremely difficult environment. And I think everyone deserves, their hat tip to them, for doing what you're doing. So, kudos, and just wanted to say thank you so much for spending the afternoon with us and sharing your knowledge and sharing your approach. And we just to end off today, I would love to get from you how people can reach out, how people can look you up online, or investigate or ask more questions. So if you don't mind telling us where people can find you and reach out, that would be terrific.
Yeah. So my website is www.healthspanimmunology.com. The office phone number is 813-869-7111. And the email currently is healthspanimmunology@gmail.com. Although my business consultant that I finally did hire is helping me create domain specific emails as we speak. So,
Perfect. Well, that sounds awesome. Thank you so much, Dr. Emma. We hope to have you on again very soon. And thank you again for sharing your story with us and all of your insights.
thank you so much for the opportunity.
Anytime, I will see you soon.